Hi, this is Neha Jain. Telepsychiatry has been around for decades, but many challenges have made widespread adoption difficult. This includes restrictions on what type of services could be provided virtually, where these services could be provided, who could provide them, and how. These challenges were removed by the public health emergency declared during the pandemic. The type of services covered and who could provide them were expanded, and the restrictions on where and how the services could be provided were removed. Let's look at what happened next. In March 2020, the number of visits to our outpatient psychiatry department dropped sharply. This was offset to some extent by phone visits and to a much greater extent by video visits. Overall, the total number of visits remained steady. This was in sharp contrast to what happened in the rest of the country. We've continued to see an increase in total number of visits, supported mainly by telehealth, as well as a reduction in no show rates across our clinics. To gauge acceptance, we conducted an anonymous patient satisfaction survey with almost 800 responses. The vast majority of our patients thought the telemedicine appointment was as good as an in person visit and would like to continue using it in the future. Next, we surveyed our clinicians. They also found virtual visits to be quite effective. In a review, 13 out of 18 studies showed that telepsychiatry had lower costs compared to face to face visits, and telehealth improved access to care to those with transportation and other access issues. There are challenges to telehealth, including personal challenges like sensory difficulties and systemic challenges like practicing across state lines. But with improved access to technology and expansion of policies, it is safe to say that telehealth is here to stay.